I'm David Siepmann. I'm a diagnostic radiologist at Willamette Valley Medical Center, and I've been working at the hospital for about 5 years since I finished my residency training at Dartmouth. And I've been always interested in computer issues. That's been one of my things. I think partly being a radiologist, it's I spend my life interacting with a large number of computer systems. But I think it's also just partly my natural inclination. I'm kind of a computer geek at heart. But I've seen various implementations of computer systems over the last few years, been involved at different facilities, and really had a sense of how well it can go or how poorly it can go if it's not done right. And so one of the things I've really appreciated from day one at Willamette Valley Medical Center is just really the close relationships that the physicians and medical staff have had with the administration. So early on, as we started to move into this process of replacing our whole computer systems with the Meditech 6 world, I very quickly got involved with our local administration and then moved from that to talking to Mike Wiekert, our COO, and Mark Medley, our division president, and about how this was working for the whole Capella enterprise. And so as a result of those discussions, we've sort of evolved into this physician advisory group, or PAG, and I was recently asked to chair that group. So I'm taking more of a leadership role in that. But it's an exciting thing. We have a group of physicians representing a broad group of specialties throughout Capella, who are really helping to guide the implementation of this dramatic change in how we all do business. And it's it's mandated by the government and so forth. There are external reasons to do it, but fundamentally I think the reason that I'm so committed to it is that I think that these computer systems have the potential to truly improve the way that we take care of patients. Done right, they help us prevent errors. They help give us information that there's no way that we could remember at the time, and they help really coordinate care between providers. But it takes a lot of work to get things set up correctly so that it works that way, and it really does take the clinical input from people who have the right kinds of expertise. And as a radiologist, I have a part of that expertise, but I certainly don't have it all. And I think that's how I see the role of the PAG is, by exploiting the range of expertise that we have within Capella, of folks who are equally passionate about the patient care and how computers can help in that process, but have different backgrounds in emergency medicine, in surgery, and so forth. That we can really make sure that we're setting up the system in a way that will really work. So it's exciting.